Most people look at their blood pressure and think both numbers are equally dangerous. The top number, the bottom number. They assume that as long as one of them looks okay, they're probably safe. But that belief is putting millions of seniors at serious risk. Because after age 60, one of these numbers becomes far more dangerous than the other. And tragically, it's often the one people ignore. Today, I'm going to explain exactly which number matters most, why it becomes more dangerous as you age, and what you can start doing today to protect yourself. And by the end of this video, you'll understand something that could literally save your life. Let's start with something simple but important. When you get your blood pressure checked, you see two numbers. For example, 150/80. The top number is called systolic pressure. This is the pressure inside your arteries when your heart contracts and pushes blood forward. The bottom number is called diastolic pressure. This is the pressure when your heart relaxes between beats. So systolic is the push. Diastolic is the rest. For many years, doctors treated both numbers as equally important. If either one was high, treatment was recommended. But long-term research following millions of people for decades has revealed something very different, especially in adults over 60. Let me explain using two real-life patterns that doctors see every day. First, there's the person whose reading looks like this, 165/70. The top number is high. The bottom number looks great. Many people in this situation are told, your bottom number is fine, so don't worry too much. And that advice has caused serious harm. Then there's another common pattern, 130/95. Here, the top number looks okay, but the bottom number is elevated. People with this pattern are often terrified, thinking their heart is under constant strain. But medically, these two patterns do not carry the same risk, especially after age 60. And understanding the difference is critical. Now, here is the key point that most people never hear clearly. After age 60, the top number on systolic pressure becomes the strongest predictor of stroke, heart attack, heart failure, kidney disease, and even dementia. Not the bottom number, the top number. Large studies like the Framingham Heart Study and others following hundreds of thousands of adults showed that elevated systolic pressure is 2 to 3 times more predictive of cardiovascular events than diastolic pressure in older adults. And it gets more serious. There is a condition called isolated systolic hypertension. This means the top number is high, but the bottom number stays normal or even low. This is extremely common after age 60. And for many years, doctors underestimated how dangerous this pattern is. We now know it dramatically increases risk of stroke, heart failure, kidney damage, vision loss, cognitive decline. In fact, treating isolated systolic hypertension reduces stroke risk by up to 40%. That is not a small benefit. That is life-changing. So why does this happen with age? Why does the top number keep rising while the bottom number often stays normal? The answer is your arteries. When you are young, your arteries are flexible and elastic. They expand when your heart pumps and recoil between beats. This elasticity absorbs pressure and protects your organs. But as you age, our artery walls stiffen. Elastic fibers break down. Calcium and plaque accumulate. The arteries become more like rigid pipes instead of soft rubber hoses. Now, when your heart pumps, the arteries can't stretch as easily. So the pressure spikes higher. That raises your systolic number. But between beats, those stiff arteries don't recoil well, so the diastolic pressure may stay normal or even drop. That is why after 60, you often see high top number, normal bottom number, and that top number is quietly damaging the most delicate blood vessels in your body, especially in the brain, kidneys, and heart. Every heartbeat sends a pressure wave that slowly injures vessel walls. Tiny injuries heal with scar tissue. Scar tissue makes arteries even stiffer. Stiffer arteries raise systolic pressure even more. It becomes a dangerous cycle. In the brain, this leads to small vessel damage, tiny silent strokes, progressive loss of memory and thinking ability. Many cases of what is called age-related dementia are actually vascular damage from years of high systolic pressure. In the heart, high systolic pressure forces the heart muscle to work harder. Over time, the heart thickens. Thickened heart muscle becomes stiff, and that leads to heart failure, even without a heart attack. In the kidneys, tiny filtering vessels are damaged. Once kidney function declines, blood pressure becomes even harder to control. So now we need to address something very important. Does that mean the bottom number doesn't matter at all? No, it still matters, but it matters in a different way. Very low diastolic pressure, especially below 60, can reduce blood flow to the heart muscle itself. That can cause chest pain and increase cardiac risk in some people. And a very wide gap between the two numbers can signal severe arterial stiffness. So ideally, we want both numbers in healthy ranges. But if we are asking, which number should people over 60 focus on controlling first? The evidence is very clear. It is the systolic number, the top number. And if your top number is consistently above 130, especially above 140, it should never be ignored, like even if your bottom number looks perfect. In the next part, I'm going to explain what the recommended targets are for people over 60, how aggressive treatment should be, and when higher numbers may still be acceptable depending on health and frailty. And most importantly, I'll explain how to protect yourself without causing dangerous drops in pressure or dizziness. So stay with me, because the next part answers the question everyone is afraid to ask. How low should your blood pressure really go after 60? Now that you understand why the top number becomes more dangerous with age, the next question is obvious. How low should your blood pressure really be after 60? For many years, the message was simple. Lower is always better. But for older adults, it's not that simple anymore. Yes, lowering high systolic pressure reduces the risk of stroke and heart problems. But lowering it too much or too quickly can also create new risks. This is why blood pressure targets should change with age and overall health. Large studies have shown that for most adults over 60, keeping systolic pressure below 130 provides strong protection for the heart and brain. Some very healthy older adults may benefit from slightly lower numbers if they tolerate them well, but for people who are frail or who feel dizzy when standing, or who have multiple medical conditions, slightly higher targets may actually be safer. The goal is not chasing a perfect number on paper. The goal is protecting organs while also preventing falls, weakness, and low blood flow to the brain. This is where many people get into trouble. They focus only on lowering the number without paying attention to how their body feels. Let's talk about something called postural or position-related pressure drops. This happens when your pressure falls significantly when you stand up from sitting or lying down. If you ever feel lightheaded when standing, a brief spinning sensation, needing to hold onto furniture after getting up, those can be signs that your pressure may be dropping too much when your body changes position. This matters because falls are one of the biggest threats to independence after 60. And aggressive blood pressure lowering can sometimes increase fall risk if not monitored carefully. This does not mean blood pressure should not be treated. It means treatment must be personalized and monitored. So, what should you be aiming for? Here are general ranges many experts use as a starting point. For adults 60 to about 75 who are active and generally healthy, a systolic range around 120 to 130 may be appropriate if well tolerated. For adults over 75 or those with balance issues, fatigue, or multiple conditions, a systolic range around 130 to 140 is often considered reasonable. For very frail adults or those with repeated dizziness, some doctors may accept slightly higher numbers if lowering them causes symptoms. Again, these are not rules. They are conversation starters for you and your healthcare provider. But what should never happen is ignoring a systolic number above 140 just because the bottom number looks fine. Now let's talk about what actually helps bring systolic pressure down safely. First, lifestyle factors still matter at every age. Even small improvements can make medications work better, or sometimes reduce how many are needed. One of the most powerful factors is sodium intake. Most packaged and restaurant foods contain large amounts of sodium. Reducing processed foods and cooking more at home can lower systolic pressure by several points. That may not sound dramatic, but even a 5-point drop significantly reduces stroke risk. Physical activity also helps. Not extreme workouts. Simple regular movement like walking, swimming, or cycling improves blood vessel flexibility over time. Better vessel flexibility means lower systolic pressure. Stress management also plays a role. Chronic stress keeps blood vessels in a constricted state, raising pressure throughout the day. Calm breathing, relaxing hobbies, and consistent sleep patterns can support healthier pressure regulation. But for many people over 60, Lifestyle changes alone are not enough. And this is important to say clearly and calmly. Needing medication does not mean you failed. It means your arteries have changed with age, and extra support is helping protect your organs. Modern blood pressure medications are widely used, carefully studied, and available in many different types. If one type causes side effects, there are usually alternatives. The goal is to find a combination that lowers systolic pressure while allowing you to feel steady, alert, and comfortable. What matters most is consistency. Taking medication regularly is far more effective than missing doses or stopping and starting. Fluctuating pressure is harder on blood vessels than steady control. Home monitoring is also extremely helpful. Checking pressure at different times of day gives a more realistic picture than occasional clinic readings. Some people have higher readings in medical offices due to anxiety. Others have normal readings in clinics but higher pressure at home. Home tracking helps your care team adjust treatment more accurately. Now, I want to address something many people say. My parents lived a long time with high blood pressure. Why should I worry? The truth is, many people who did not experience major events are simply the survivors. For every person who does fine, many others experience strokes or heart problems earlier. Population studies clearly show that controlling systolic pressure reduces serious complications. Another common thought is, I feel fine, so it can't be harming me. Unfortunately, elevated blood pressure rarely causes symptoms until damage has already occurred. That is why it is often called a silent condition. Waiting to feel something is not a safe strategy. Preventing damage is always easier than trying to recover from it later. Now here is something very important. Lowering blood pressure should never be done suddenly or without guidance. Stopping medication abruptly can cause dangerous rebounds. Any changes should always be discussed and adjusted gradually with your provider. The goal is steady, sustainable control, not dramatic swings. In the final part, I'm going to give you a simple step-by-step plan you can use to protect yourself, monitor your pressure properly, and have more productive conversations with your doctor. And I'll also explain why many people are still being told the wrong thing about which number matters most. So let's go to the final part, where we turn all of this into clear actions you can start using. Now let's turn everything you've learned into clear, simple steps you can actually use. Because information only helps when it leads to action. Here's a practical plan that many people over 60 can follow to protect themselves and stay in control of their blood pressure. Step 1, know your real numbers. If you don't already have a home blood pressure monitor, consider getting one. They are affordable, easy to use, and give you information that a single clinic reading never can. Check your pressure at the same times each day, such as in the morning before breakfast and in the evening before dinner. Sit quietly for a few minutes before measuring. Keep your feet flat on the floor and your arms supported. Write the numbers down. What matters most is not one single reading, but the average over time. Step 2, focus on the top number. If your systolic pressure is consistently above 130 and especially above 140, that is a signal to take action. Even if your bottom number looks fine, this is especially important after age 60. Do not assume you are protected just because your diastolic number is normal. Step 3, pay attention to how you feel. If you ever notice lightheadedness when standing, feeling weak or unsteady, trouble concentrating after medication changes, these are important signals to share with your provider. Blood pressure control should protect you, not make daily life harder. Finding the right balance is part of good care. Step 4, use lifestyle tools as daily support. Even if you take medication, lifestyle habits still matter. Reducing processed foods, staying active, managing stress, and keeping a regular sleep routine all support healthier blood vessels. These steps may seem simple, but when done consistently, they make medical treatment work better. Step 5, take medication consistently if it is part of your plan. Blood pressure medications work best when taken regularly. Missing doses causes pressure to rise and fall, which is harder on your arteries. If you ever feel uncomfortable with a medication, that does not mean you should stop it on your own. It means you should talk to your provider about adjusting the plan. There are many options, and most people can find one that fits them well. Step 6, bring your home readings to appointments. This changes the entire conversation. Instead of guessing based on one reading in a clinic, your provider can see how your pressure behaves in daily life. This allows for safer and more accurate decisions. Now let's talk about why so many people are still confused about which number matters most. For many years, medical advice treated both numbers equally, and for younger adults that made sense. But as research has followed older populations longer, the risks have become clearer. After 60, systolic pressure becomes the stronger predictor of serious events. Unfortunately, not all messaging has caught up with that reality. Some people are still told not to worry if the bottom number is good. And that misunderstanding can delay treatment for years. That is why knowing this information yourself is so important. It allows you to ask better questions and be an active participant in your care. Let me bring this back to something simple and very human. Most people want the same things as they get older. They want to stay independent. They want to stay clear-headed. They want to keep doing the activities they enjoy. Protecting your blood pressure is one of the most powerful ways to support all of that. Not because of fear, but because it quietly protects the systems that keep you functioning day after day. Your brain, your heart, your kidneys. They all benefit when systolic pressure is kept in a healthy range. And the good news is this is something you can influence. With monitoring, with daily habits, with appropriate medical support when needed, you are not powerless here. Before we finish, I'd like to suggest two simple things. First, if this information helped clarify something for you, consider sharing it with someone you care about. Many people over 60 are walking around focusing on the wrong number without realizing it. Second, take one small action this week. Check your pressure. Start tracking it. Or schedule a conversation with your provider if your top number has been running high. Small steps can make a big difference when they are taken consistently. Your heart has been working for you your entire life, every single day without complaint. Taking care of your blood pressure is one way of returning that care. And now you know which number deserves your attention, not to create worry, but to create awareness and confidence. Thank you for spending this time with me. And in the next video, we'll continue talking about simple, practical ways to support your health as the years go by, one steady step at a time.